Well. Thank you so much. Thank you so much. I can see my friend React Lord, you are on the background. Welcome to PAMLI Vlogs. And today we are having a very wonderful discussion on this topic that is appearing on the screen. So, my fellow friends and my fellow colleagues and everybody that is watching me, welcome to this channel and let's keep rolling. Let me just invite this my friend to greet you and then we will continue. Hello my friend, how are you?
I'm fine. How about you?
You are on the screen. Are you fine?
Yeah.
Okay, thank you so much. I will invite you. Let's just roll the topic and let's keep on going. So I will invite you again so that you can contribute to this channel. So thank you so much for
Okay. Thank you
joining
so.
us and let's continue. Now, the topic of today, I have posed a question there. Is nipple discharge a sign of breast cancer? Is nipple discharge a sign of breast cancer? And there is some trickling down, there is some tickers going on that causes of nipple discharge in non-lactating women and non-pregnant women. So that is the main topic that we want to discuss and welcome everyone to this channel. So if you are on, testing, is my volume well? It's okay. Okay, let me test this my volume if it is okay. 1, 2, 3, testing. Are you hearing me? Okay, so my volume is very well and I thank you so much for joining this channel. So the volume is okay. Just reduce it. Are you hearing me? If you are joining PAMLI Vlogs for the first time, kindly hit the subscription button, written subscribe, turn it on for more videos that we will post. PAMLI Vlogs does a lot of medical videos and weight loss solutions. So kindly, if you are here for the first time, do not forget to like the video that we are on and also to subscribe to this particular channel. So we are discussing about nipple discharge from a non-lactating mother or woman or a non-pregnant woman. What can be this particular process and what do we mean by nipple discharge? So if you want to hear all this, stay with me until the end of this video. And those who will be joining me, you will join me through StreamYard link. I will invite you people to contribute by the end of this video. So React Lord, stay tuned. Do not go away. I'm seeing you on the background. And with this, I will be very, very happy if you stay with us until we clear this particular discussion. So my fellow colleagues, my fellow friends, any fluid or liquid that comes out of the breast nipples but not caused by pregnancy or breastfeeding, we refer this as nipple discharge. And it can affect both breasts or one single breast. That we mean by saying it can be unilateral or bilateral. And in this scenario, we are going to consider which type of discharge is normal and which type of discharge is abnormal. So stay tuned. As I've mentioned earlier, a normal discharge, that one we obviously know milk. When a woman is breastfeeding, we have a discharge that is milk, breast milk. That one everybody knows. Even during adolescence, some hormonal imbalance can cause nipple discharge, which is normal, does not need any treatment, does not result to any pain, does not worry any woman. nipple also can discharge when there is stimulation. Let's say when a woman is jogging, when the clothes normally touches the breasts for a period of time, then this results into stimulation, and we get that there's a discharge, and this is physiological, and this is very, very normal. Now, those are the three scenarios that we can talk about normal breast discharge. So what are these abnormal breast discharge that almost all women normally fear? And what I've placed on the screen in terms of a question is nipple discharge a sign of breast cancer? Stay tuned so that you be enlightened and you get the true information that you need to know about this particular discharge. So one of the reasons why you may have nipple discharge is what we call an infection affecting the breast. These infections can be mastitis, that is inflammation of the breast, or it can be breast abscess. In normal layman, we call them pus in the breast, and mostly are caused by bacterial infection. And in this scenario, we'll get that there is a discharge which we term as white, cloudy, or even yellow, and sometimes filled with pus. Occasionally, you can find it is greenish. That is a sign of infection. And if you see this, kindly consult your clinician, consult your nurse or your doctor for further evaluation. Of course, in this particular breast infection, we may go ahead and aspirate if it is pus, take for culture and sensitivity to verify which kind of bacteria is affecting you. Of course, when we'll be waiting for result, we will put you on antibiotics, which you can take for a period of from beginning of 5, 7, or 14 days, depending on how you presented. So number one cause of breast discharge, other than the three I talked about, the normal one is breast infection brought by mastitis, that is inflammation of breast, or even breast abscess, that is pus in the breast. That is number one. Number two, we have what we call galactorrhea. Galactorrhea, I will explain what this means. Now, galactorrhea is passing of milk through breast in an unpregnant woman or an unlactating woman. If you are having breast discharge in terms of milk coming out of your breast and you are not pregnant or you are not breastfeeding, then you suspect this is what we call galactorrhea, passing of milk in the breast. Of course, we should understand that after stoppage of breastfeeding, depending on each and every woman, breast can still, if you express your breast, you can still feel or you can still see the milk even up to a period of 2 years, that is the minimum, the maximum normal. Can be between 1 year and 2 years. 2 years if you express your breast and you will see milk. But other than that, if you are not breastfeeding and you are not pregnant, in early pregnancy you can see milk in the breast if you express, or late pregnancy you can see milk when you are expressing your breast. But now, when you are not pregnant and you see milk, that's what we call a milk discharge. That is what we call galactorrhea, and it normally occurs due to what we call prolactinoma. Prolactinoma, the pituitary tumors. All of my videos have been talking about anterior pituitary glands producing some hormones, and this particular one, the prolactin, which normally help in milk production. When you have a problem with the pituitary gland, there's a tumor called prolactinoma. This one will increase the levels of prolactins in your blood, and you may have breast discharge, and this one may be a milky discharge into your breast. So take care of that, and it normally presents with blood visions when you have pituitary tumors, and they are normally benign. Kindly note that they are not cancerous. Prolactinoma is a benign tumor that normally we treat. We normally take your prolactin levels, and if we see they are elevated, then of course we will start a drug called cabergoline and even bromocriptine that will normally regulate this your prolactin level so that you don't see milk in your breast. So if you are a lady who is not breastfeeding or who is not pregnant, whether early pregnant or less pregnant, and you see milk discharge in your breast, then you may suspect this might be prolactinoma. Now let's move. Birth control pills. The family planning methods we normally use. Some ladies, this family planning normally manifests differently in each and every individual. So you will get that one person or one lady or a group of ladies presenting with discharge from their breast, which sometimes might worry them. We'll take their history and physical exams, and if we find out that this discharge is due to birth control pills, either combined oral contraceptive, the so-called POX, or progesterone only, then sometimes we may change the method of family planning. So that is another cause of discharge from the breast. Another cause, that is now number 3, we will talk about opioids. Opioids, the drugs, classes of drugs that normally, if you take, you may end up having breast discharging fluids. For example, the class of opioids, and we mentioned in my early videos, one of them is morphine. Antipsychotics like risperidone also can cause milky discharge, and antihypertensives like methyl-dopa can also cause this type of discharge in your breast. So we will also evaluate this in terms of which drugs are you taking, and if we verify that your discharge is majorly because of the drugs you are taking, then we'll be able to give you the necessary advice as per the way you are presenting. Now let's move on. Fibrocystic breasts, these are benign white-like growths that normally occur in a woman's breast, and they have a lumpy feelings and rope-like when you palpate them in terms of their texture. And sometimes they will end up bringing what we call a greenish discharge or dark brown discharge, sometimes mostly non-bloody in the nipple. So if you see this, we may investigate further to verify that is it a fibrocystic nipple, fibrocystic breast bringing this kind of dark brown green discharge that we need to act on and to find out. The main reason of this, we are trying to rule out any possible signs of breast cancer, because most of the ladies, most of the young women we meet when they are having breast discharge, the first thing they will think of is, am I having breast cancer? So that is another cause. We talked about hormonal changes. Sometimes can be normal, physiological, or sometimes they can be tied to problems of the regulations of hormone, particularly those who are suffering from a disease called polycystic ovarian syndromes. When you have high estrogen levels, mostly the cause of this is unknown, but we will try to elucidate whether the one which is known, the polycystic ovarian syndrome, is what is affecting you. Okay, Akot Pole sana. I've been using some technical words. I apologize for that. But there are some medical terms that sometimes to talk in a normal layman's language can be very, 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 very difficult. Thank you so much for joining. And yes, you are saying, family, are you at work? Where is your boss shows up? No, I was on night duty. I'm off duty. That's why I'm doing this. I'm teaching the society. I'm off duty. Yes. So as we continue, thank you so much, Akot and React Lord, for keeping in touch with me. And also, yes, React Lord, I've got a new. We will do that at the end of the video. Kindly stay tuned as we continue uh, doing this. Now, hormonal changes has no risk in breast cancers, and you take note of that. Now, we have a condition. I've been told to use a normal layman language. Sometimes condition called mammary duct ectasia. In normal language, is the milk ducts under the nipple are thickened and they become wider and then get blocked. And this one will result into accumulation of fluids that is brown and cheese-like. So this is just a condition that can be managed. When the ducts are blocked, they can be managed, and the drugs that we will prescribe to unblock them. And if the condition persists, then we may do further investigations into this your breast to verify that it is not cancerous. And then there are some causes of this breast discharge that is called benign tumor of milk duct. And this is not cancerous. In fact, we call them interductal papilloma. Forgive me for saying those tough words, but I have to say it. Mostly discharging bloody discharge from the breast, but they are not cancerous. Now, during menopause, when you are clicking 45 and above, you may have some discharge from your breast. This is because the reduction of progesterone and estrogen levels, and they are mainly whitish and sometimes milky, but not related to what I've talked earlier about prolactinoma. And this one will disappear by itself as the age goes by. If the woman is worried, then we may initiate a drug called bromocriptine that I was talking about to clear this particular milk. Another cause, when you have trauma in your breast, when something knocks your breast or you have an accident, then of course you will have a discharge from the nipple that may mainly bloody because of the traumatic incident that occurred mainly during accident. Uh, a condition called and active of the thyroid glands can also result into this, and there are some big medical terms that I don't want to talk about for the sake of my community. Now, and lastly, in the causes of breast discharge, last but not least, and the main reasons and why we want to answer the question, is nipple discharge a sign of breast cancer? Yes, it can be a sign of breast cancer, but we may look for the following, particularly when you have a bloody discharge from the nipple and it is unilateral, meaning it is on one side of the breast. Then we say, think of breast cancer when the following occurs to you or to your patient, or when you are a medic. There is a breast lump. Breast lump. I'm trying to explain this. Breast lump, if you palpate your breast, let me use a normal layman. If you touch your breast, you will feel something hard in that your breast. In the normal In normal scenario, breast is supposed to be soft, not having lumpy feelings. When you have a breast lump or that hard thing like a stone into your breast, then we may start thinking of this. When the nipple is dimpling, like like this, my dimples. Yeah, when your nipple is dimpling, then we can start suspecting that. When you have severe breast pain, not tied to inflammation or not tied to the disease that I started talking about, that is mastitis, inflammation of the breast, when the breast is swelling and is painful and it is feeling hot, you might think when your nipple is retracted, it is retracted or inverted inside out, we may think of uh, breast cancer. When you have redness and even changes in your skin texture of the breast, look at that orange, the outer covering of the peel. When you are peeling your orange, that's texture of the orange. If your breast look like that, we call it peeled orange, then we might suspect that you have cancer. When you check at your axilla, extraaxilla armpits, and you feel there are some swellings, we call them lymph nodes, then we may start suspecting that you are having breast cancer. And of course, if the breast now is swelling. So those particular listings that I've given may link us to breast cancer. Then we cannot just make a conclusion that this is a breast cancer. We must go ahead and do laboratory investigation. For example, if we suspect that visual discharge might be tied to or might be linked to something, a condition that may result into cancer, then we do what we call biopsy. There's a chunk of meat we remove from your breast, and then uh, we send for laboratory process called histology, and it will tell us whether it is cancerous or it is not cancer. Of course, we'll send you for an X-ray that we call mammogram or mammography. Then we will also look at this X-ray and interpret to verify that this is cancer or this is not. Then there's a type of X-ray we call ductogram. It's a type of mammography where they will inject a contrast into your breast, contrast material. Then we observe to verify this is not cancer or not. And of course, we can even do ultrasound of the breast. And we will also do what we call we will also do what we call hormonal profile to verify whether there is hormonal imbalance or there's no hormonal imbalance. If there's hormonal imbalance or there's too much prolactin levels or there is reduction of estrogen or progesterone or there is increase on estrogen and progesterone hormones, then we will verify this and act necessarily. And also we may do thyroid function tests uh, to help to know whether this is also tied to one of the causes of breast discharge. Of course, management of this particular breast cancer will always be case by case. Management of breast nipple discharge will always be case by case. There's no specific management that if you have this particular nipple discharge, then this is the drug we will give you. The reason why I'm saying this, patient will always present differently, and some will also suspect that they are having cancers, and we will do the investigations that I have mentioned earlier. Of course, in terms of biopsy that I'm talking about, we'll do what we call fine needle aspirate. There's a needle that is inserted into your breast, and some chunk of meat is taken for histological examination. And this will give us the grade and stages of this particular cancer as we go about. Now, nipple discharge should not tie yourself to cancer. And I'm repeating again, if you have nipple discharge, it is not actually that you have a cancer, but it may point towards having breast cancer, particularly on those issues that I've mentioned earlier. So let me invite this my friend and add volume so that may ask a question. React Lord, react. Hello, I am with you
Yes.
now. You said you wanted to ask some question. Let me put this one in volume so that I get you. Let me reduce the volume. You may reduce your volume.
Okay, I am asking. My friend was diagnosed with I don't know, nikufura, like something like a lump inside left breast, and it was removed. After it was removed, she stayed for almost 1 year, and then it moved to this side and this side of the armpit, two armpits. So I'm asking, what is that? Because when we were at the hospital 2018, she was diagnosed with. We never get the results because the hospital, I won't say the hospital's name, but it withheld the result even after we paid about, we were charged 5,000. We were using NHIF, but we were charged 5,000 for the testing of either it is cancerous or non-cancerous, but we paid 3,000 and we never had the results up to date. So 2 years later, she developed another limb under this armpit and also this armpit. So I'm asking, should we be scared of that, or what does that mean? Because you're a doctor, just tell us. Thank you. Yeah, I'm done.
Okay, thank you so
Yes.
much, React. You know, network is taking time to respond. Now, let me respond to that. I talked about a condition called fibrocystic breast, whether they where. Okay. So this fibro. Let me reduce this my volume so that I. Okay. Now I talked one of the causes of the lumpy swellings that is not tied to breast cancer. I talked about fibrocystic breasts, and I said that there are white-like growths into the breast, and this they can feel like lumpy, but they are not tied to cancer. That's why I said that there are some signs and symptoms that if a patient have, then we may think of as cancer. Now, treatment of cancer or management of cancer of the breast should be early enough to avoid it being to avoid the condition worsening. Now, in the scenario of the question that you asked about that your patient, I hear you said that he had a swelling. They incised it. I don't know whether they did a laboratory investigation for this particular chunk of meat that they took. Now, in this scenario, we cannot tell whether this is cancerous, but we can deduce from what I said earlier that things that might point towards a breast having cancer. And I want to use the signs and symptoms that you talked about. One, there was a swelling, a lumpy like swelling into the breast. Two, there was a lymph node involvement. Three, it was unilateral, which means it was on one side. So those three criteria, it's clicking my head that this might be cancer. So the only thing you need to do is to follow up with that facility so that they can tell you that that chunk of meat they took, what was the result, so that if it is cancer, if it is on early stage, then you should be able to be managed, either patient going through radiotherapy or even chemotherapy drugs to help the patient, because when it will reach us, there is a stage that when it will reach, then management will be very, very difficult. So my advice to you in terms of that your question is that that patient should even redo that particular procedure that he did. If that particular facility that she went to does not want to release the result, I don't know which conditions they are thinking of, or what went wrong in terms of releasing the result, because it is unethical to withhold a patient's result, particularly in this particular scenario. So if there is nothing tied to it, then they should be able to release this result and act as fast as possible. It was just a fibrocystic um, breast swelling, then they should be able to give some drugs to relieve it. If it is a one that will need an excision, taking the patient to theater, then excising that wart or that growth, then it will be so beneficial to the patient. Now, before we think of this is cancer, though it has some three typical signs and symptoms that is pointing towards is you should be able to go back and do those particular investigation. I talked about biopsy, which he did, or fine needle aspirate. She could do what we call mammography, depending on the age of that patient, and also even breast scanning, ultrasound of the breast to verify, and then you discuss with your doctor, other than wasting time. You know, cancers normally take time to grow, and when it's full grown, then it will be very, very difficult to do what? To manage. So, my friend, I will urge you uh, to help this patient to go back to the facility as early as possible. I hope you are answered. I'm waiting for you to ask again. I'm done. So, my friend, will urge you. Yes.
Yes. Thank you so much.
So, is there anything you can? You,
Thank you so much. I feel I got the right answer because it is now about 3 years after the hospital in the river somewhere before you go to Tengela. They with all the results, but there's no problem. I think I want to ask you more. If can we go to another hospital since I no longer live in a river or somewhere within the hospital? I'm too far to be near that hospital. Can I go in another hospital and start again without the results? Thank you. Yeah. Can I go to another hospital?
okay, thank you so much, Riaplod. What I'll advise is this: patients normally have rights. They have right to refuse treatment. They have right to go to any facility of their choice. So, if you've decided to opt for a second opinion or a second hospital, if at all you are not satisfied with this particular facility that you went to, then it will be very beneficial to the patient, because at the end of the day, we want everything to be well into our patient. They should be managed well. So, if that facility was not willing to cooperate the way you are saying, then I will rather stick to what you are saying. Just seek another opinion in a different hospital. Let them start afresh. Let them give you the result as early as within a week. You should be able to have all your result at hand, and even the decision that the doctor that is seeing the patient, the gynecologist, to make a decision to help this particular patient. Thank you so much for that. I don't know whether you have any more question. Let me bring you back to the screen. If you have any other questions, you might ask. So, do you have?
I have no more. Please, I have no more questions. Thank you so much. Thank you so much, guys. Subscribe to his channel, and I appreciate you for hosting me. Thank you. Goodbye. I appreciate you for hosting. Thank you. Goodbye.
Thank you so much. That is my friend, a fellow YouTuber called React Lord. Kindly look at his channel and subscribe. Now, I want to answer some of the questions that guys have sent here from the discussion. I'm welcoming Omaya girls. Thank you so much for joining. Akot TV, you've been very nice in this channel in terms of contribution. Thank you so much. And React Lord, can you share the link and tell guys to come? Now it is a question time. I think I'm through with the presentations. I'm through with the presentation, and as you can see now, I'm just welcoming people to PAMLI Vlogs. And if you have any question, you can ask. I want to ask guys to now. It's a time for Ask PAMLI Vlogs medical questions. Ask PAMLI Vlogs. Uh, any medical question, welcome all. Yes, React Lord had a very nice question. He had a patient that had a breast swelling and a lump, and biopsy was done, but unfortunately, she's talking about a facility that withheld the results of that patient. So painful. I hope you will react. You will follow up this particular results, and Baba Mama Tua. Okay, I'm welcoming this called Baba Mutua. Karibu sana for PAMLI Vlogs, and in this channel we bring medicine in your doorstep, in the comfort of your home. Ask any question, and you will be answered. Kindly, if you want to chat with us, there is a StreamYard link. Click it and join us on the screen, so that you can greet people. You can greet us. Okay, I'm seeing thank you so much. I'm happy Baba Mutua is me. Thank you so okay, thank you so much, React Lord. I'm happy to hear you say that. And with this, it will be very vital for those people who are following me in this particular channel. Ecot TV asked me something which is very funny, and let me just pin it so that we can. Family, you are at work. What if your boss shows up? Yes, I'm on night duty and I'm off duty. I was on night duty. Now I've cleared my duty, officially off. So no big deal. So we do this here because network is very stable. And as you can always see, when I'm doing live with my network, it is normally hectic and problematic. So that's why I'm here today to do this, and kindly share this on the group so that we enjoy. And you said something like I was using words that are so technical. Gynecological words are very technical, and sometimes to explain them in normal layman's language is very difficult. But I was trying my best, and I hope all messages are at home. So anyone who wants to join us through hmm? What? So welcome to PAMLI Vlogs. Subscribe to PAMLI Vlogs YouTube channel. Click the link provided. um, and we will always be together. So guys, I want to leave you a bit. I take a bit of some break. I will be back. I will be back. I'll mute the Yeah, I'm back. I'm back. Stay tuned. Still doing some settings, and I will be back. Stay tuned. Stay tuned. Well, now, thank you so much for those who have joined me, and from the beginning up to uh, we are ending this live stream, and see you in the next video. If you have not subscribed to this channel, hit the notification bell, written subscribe, turn it on for more videos that we'll post. Muchas gracias.